Number 5, Lawrenceville, Georgia, Gwinnett County, 2,000 cases. Number 4, Marietta, Cobb County, 2,500 cases. Number 3, Jonesboro, Georgia, Clayton County, 3,800 cases. Number 2, Decatur, where it's greater, DeKalb County, 10,800 cases. And coming in at number 1 is Atlanta, Georgia, Fulton County, with approximately 19,500 HIV cases already for 2025.
HIV in the Black community in America. Welcome back to the channel. Today we're diving into a very serious issue. HIV in the Black community in America. HIV is no longer front page news, but the statistics show that it remains a crisis, especially for Black men and women. This isn't just a medical story. It's also about history, behavior, poverty, and mistrust of the system. Across the United States, about 1.2 million people are living with HIV.
When I was born, I was HIV positive. And when I turned 5, I had symptoms of AIDS. I had fungus in my brain, blood infections, pneumonia. I went cold blue a couple of times. When I was about 5, they said I was full-blown AIDS. And right now, I'm doing really good.
What's the hardest part for you, Hadia?
Basically, that's like when your friends die. A lot of my friends have died of AIDS. No one really knows how long anybody's gonna live because I don't tell myself like, oh, you have AIDS, or I could go outside and get hit by a bus tomorrow. And you never know if you stay in your bed and feel sorry for yourself and don't get up with the birds and just sit there and say, well, I'm gonna die. Why get up and try and make a difference? But when you say, well, today's another day, I can get up, I can do something, make something positive.
Every year, around 30 to 35,000 new infections are reported. But the burden is not evenly spread. Black Americans make up 13% of the American population, yet they account for nearly 40% of all people living with HIV. In 2022, Black, gay, and bisexual men alone represented over a third of new HIV diagnoses. Black women, who are only 13% of women in the United States, account for more than half of new HIV diagnoses among women. This is not a coincidence. It's about systems, conditions, and realities that shape healthcare outcomes.
In all seriousness, in the past week, I've had several patients coming in finding out that they're HIV positive. And y'all keep making these posts and these jokes, and it's not funny. Like, this shit is ruining people's lives from their early 20s to even as old as 50 years old. Stop playing. It's not funny. It's nothing funny about it. And you want to know what's so crazy? I seen a video of this gay dude on TikTok. He's a viral dude bragging about how he just moved to Houston and he just met somebody baby daddy, somebody trade, somebody thug drug dealer, and he let him fuck the shit out of him first night because he grown and all of that, and he sent him on about his way. Y'all think this is funny? You know how many down low men it is out here playing? It's not funny. Ladies, strap up, because these dudes is disgusting. Disgusting.
Recently, in Atlanta, Georgia, sometimes called the Black Mecca of America, Atlanta made headlines. In 1 year, about 20,000 people in Atlanta tested positive for HIV. That number rivals entire countries. Atlanta is not unique. Many cities with large black populations, especially in the South, remain epicenters of the epidemic. So why is HIV concentrated in Black America? Let's break it down. The first issue is healthcare access and poverty. Many Black communities, especially in southern states, lack affordable healthcare. Many states with high Black populations refuse to expand Medicaid, which makes it harder to get HIV prevention drugs like PrEP. Also, poverty, unstable housing, and unemployment all make prevention and treatment less consistent. Number 2, there's high community viral load. Once HIV is common in a community, even average sexual behavior carries more risk. Black people aren't having more risky behavior than white or Latino people. Studies show otherwise, but because HIV prevalence is already high, the chance of exposure is greater. Then we have mistrust of the medical sector. This is huge. The Black community's mistrust of healthcare is rooted in real history. The Tuskegee Syphilis Experiment of 1932 to 1972, where Black men were left untreated so researchers could study the progression of the disease. Forced sterilizations of Black women, particularly in the 20th century, often without their knowledge or consent. Then there were reports of drug trials on Black foster children in the 1980s and 1990s, where experimental HIV drugs were tested without proper protections. These abuses fueled deep skepticism, leading to lower testing, delayed treatment, and hesitance around drug prevention.
First alert out of Malden, where a man is facing charges for exposing someone to HIV. The suspect, Christopher Miller, is also charged with identity theft. Malden police started investigating July 12th when they were called to an apartment complex for a disturbance. They found Miller there. Officers said Miller had warrants out for his arrest and gave them a fake name. While investigating, police say Miller admitted the woman victim was pregnant with his child and he didn't want her to know he had HIV. Miller was booked into the Greenville County Jail. Of course, we'll keep you updated on the latest of this case.
Behavioral factors. Stigma around HIV and homosexuality in some Black communities discourages people from seeking care. Incarceration also plays a role. Black men are disproportionately imprisoned, and HIV spreads in prisons. When people return home untreated, infections spread back into the communities. Then there's substance abuse, including injection drugs, which also contribute in some areas, though less than in the past. Breaking down the statistics by race. Black Americans' new diagnoses in 2022 made up 38%, while Latino Americans made up 30% and white Americans made up 25%. In terms of gender, Black women made up 55% of new cases among women, while Black men had the highest burden overall, especially gay and bisexual men. By region, the South accounts for 51% of all new HIV cases in America, and it's where most Black Americans live. And there's a prevention gap. Only 8 to 10% of Black Americans who should be on PrEP are actually prescribed it. Compare that to much higher rates among white patients. In terms of the historical context and mistrust, it's important to emphasize this. The epidemic is not only about individual behavior, it's about history and systems.
HIV is being widespread in North Carolina, South Carolina, Georgia, Alabama, Mississippi, Louisiana, and Texas. Know your status. I just took an HIV test about 30 minutes ago, and of course it was non-reactive. Use protection or be celibate. You have people out here that are married. When they get mad with their husband or wife, they go and run to their sneaky link. And when you're running to that sneaky link, do you think that you're the only person that they're sleeping with? You can't trust somebody to lose 20 damn pounds to get rid of hypertension and die in type 2 diabetes. You think you can trust them to only sleep with you unprotected? You gotta be a damn fool. Listen to me. People are neglecting their health. They take high blood pressure medicines every day. They take anxiety medicine every day. They take all kind of medicine every day when they can simply work out. You think I'm gonna trust them? Know your status. I don't give a damn if you only been sleeping with one person. Go get tested tomorrow. There are free centers all over the world. Go get tested. That's it.
The medical mistrust in Black America is not just paranoia. It's memory, Tuskegee sterilizations, and unethical drug testing has left scars. Many doctors promote a pill like PrEP or encourage HIV testing. Some Black people don't see that as protection. They see it as another experiment. Without addressing this mistrust, prevention and treatment efforts will always hit a wall. So, is HIV increasing in Black America? Overall, new infections are slowly declining nationwide. But the number of Black people living with HIV continues to rise because the community already carries a disproportionate burden. The roots of this crisis are complex, from poverty, high prevalence, stigma, incarceration, and a justified mistrust of the medical system. HIV in America exposes a painful truth. Health is not just about medicine, it's about justice, trust, and access. Until those issues are faced head-on, Black America will continue to bear the heaviest weight of this epidemic. Thank you for watching, and don't forget to like, share, and drop your thoughts in the comments. Do you think the root problem is behavior, history, or systemic neglect?